Local Women Magazine presents Local Women Podcast, the show for things that matter. The Aesthetic Podcast from Local Women Magazine. This podcast is brought to you by BTL Aesthetics Ireland, supporting clinics with aesthetic solutions.
Hi and welcome to the Local Women Aesthetic Podcast. I'm Emma Heaney from Elite Aesthetics, and today I'm delighted to be joined by Lisa Waring from Face Therapy and Eye and Dr Bonny from Dr Bonny's Clinic. Hello ladies.
Hello Emma.
So today we are going to focus on aesthetics in 2025. What's new, what's trending, and I'm delighted Lisa has just come back from IMCAS in Paris, so we're going to hear all about that.
Oui.
So Lisa, how was IMCAS in Paris?
IMCAS was incredible, as it always is. This is IMCAS, first of all, it's a congress that happens every year for cosmetic plastic surgery and for dermatologists. It's the place to be if you're wanting to find out what is new in aesthetic medicine. We all want to find out what's new and what we should be bringing to our patients. This year for me, though, I think was actually the most exciting because it kind of showed me what we can bring to the clinic for our patients, which we are probably already doing right now, but bringing us to the new trends in aesthetics, the new era, and it's all about skin. Skin is in. So basically what I have taken from it is what is trending in 2025. Stuff that we probably are already offering on our clinic, like biohacking, these new terms that perhaps we're already doing, using devices to optimize skin health. Collagen banking, we're already doing that in clinic, but they've got these new terms for it. The likes of using biostimulators, exosomes are trending, polynucleotides are trending, stuff that we are all using in clinic to kind of optimize skin health.
You've talked about collagen banking, and I know you wrote a lovely piece on social media about collagen banking. Do you want to sort of elaborate on it, Dr. Bonny?
Yeah, so collagen banking, I guess, is a term that is part of regenerative medicine. Mm-hmm. Regenerative medicine is massive and getting bigger throughout 2025. So regenerative medicine is when we're looking at prolonging skin quality, anti-aging, preventative treatments that really zoom in on the body's regenerative properties, their natural healing processes. And collagen banking is part of regenerative medicine. So yeah, I didn't go to IMCAS. Very jealous. Seen all of your photos, all of your videos. It looked amazing.
I didn't go either. But
no,
Monica's on the cards for me.
It is, absolutely. So yeah, collagen banking has been around for a while, but I assume in IMCAS they were promoting it, talking about it, educating practitioners on it. And like I said, it's part of regenerative medicine. So improving the body's regenerative properties, healing properties to promote collagen and elastin to make you look and feel younger.
Yeah.
And what do you think about collagen banking, Lisa?
Well, I mean, obviously as a woman, perimenopausal, I know, and as we all know, that we lose collagen at about 1 to 1.5% per year from mid to late 20s. By the age of 60, we'll probably lose up to about 50 to 60% of our natural collagen that we have. So for me, building up those collagen stores is vital. In my practice, we use biostimulators, the likes of Sculptra, to encourage collagen production. And getting the amount of collagen stores that we can from an early age, as Bonny said, about regenerative aesthetics, and that's helping to replace lost or damaged tissue that is associated with the aging process. It's kind of like a subfield of regenerative medicine. And I'm really excited to be involved in aesthetics in this trend because we're, as I said earlier, we're already offering all this in our practices. I know that you have a lot of devices in clinic, and I know you do a lot of injectables, both of which are collagen stimulating. But I think that obviously, we want to encourage collagen production. Our patients are much more educated these days. So I think practitioners need to be on board with the advancements in medical aesthetics, and we should be able to offer all those advancements as well.
Yeah, I think there's a era of less is more and a rise in sort of that natural rebalancing of the face as well. Yeah, I think that's what I've been seeing for quite a while. I do a lot of collagen stimulation treatments as well. I mean, I love my microneedling, as we know. As well, I do biostimulators too. Interested to hear a little bit more about Sculptra, and we know that you're one of the clinical trainers for Sculptra.
Yeah.
What is the ideal patient for sculpture? Because we get a lot of questions about that. I get a lot in my clinic. I don't know about yourselves.
I don't do sculpture, so I'd love to know, actually.
Oh, you definitely should, honestly. The ideal patient is, honestly, anyone. Anyone is your ideal patient. Someone who has lost elasticity, someone who has increased laxity, someone who needs some volumization, someone who wants skin tightening, someone who needs rehydration, someone who has pigmentation, acne scarring. I mean, every single patient, tick, 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 tick. Everyone will benefit from Sculptra.
And who isn't suitable, you know, from a medical point of view?
Well, anyone who you would not treat with your regular dermal fillers. We would need to be anybody with a hypersensitivity, immunogenic response, anything that, you know, basically that you wouldn't treat with normal dermal fillers would probably be a no-go for Sculptra.
And Sculptra, I know that there's more than one treatment, so we know the treatment protocol, but would you like to tell everybody else what the treatment protocol is for Sculptra?
Sculptra treatment protocol, I mean, I suppose this will differ for every individual. That's why we require a patient assessment. We'll do a facial assessment scale, identify where there's loss of collagen, where there's loss of elastin. We'll do a SAG test where it's not very pretty, but we'll have the patient bend their face forward and assess the amount of laxity or submental fat. We'll do a pinch test to see how much skin we can pinch, basically. You can do this yourself at home. And then once we identify the amount of collagen replacement we'll need, they do say probably a rule of thumb is 1 vial per decade. So for me, I'm 20, so we would need 3 vials. No, but in all honesty, you're probably looking at typically 3 vials. And then after that 3 vials, you'll do them 45 days apart, which is 6 weeks. Hope that math is correct. And we'll get them back in for a reassessment and assess then, do we want to do another vial or is that enough? Some people, like Bonny, may only need 1.
None.
No, but for none. Yes, very good. No, you need 1. She needs 1. I'm only joking. No, but for example, you know, patients may not require more than 1 or 2 vials, but obviously it's all about assessment.
Lovely. And I'm not going to put my neck down now in case I get the SAG test done from the side.
You don't need any, you're gorgeous.
I don't know. So, Bonny, what biostimulators do you offer in your clinic and recommend to your patients?
So yeah, we're primarily an injectable clinic, but I mean, to make your treatments last longer, look more subtle, to really get a holistic approach to the appearance and rejuvenation of the face, collagen stimulation is so important. So biostimulators that we would add on to our injectable patients, things like Profhilo, polynucleotides. We do a lot of microneedling. Microneedling is got really good efficacy of improving collagen, 200-300% across multiple sessions. So yeah, we do a few different treatments, all depending on patient age, patient's concerns, how much downtime they want, price, budget comes into it as well. So we offer a range to our patients. We will consult with them and allow them to choose at the end of the day what suits them best.
Excellent. So when you talked about injectables, I suppose, like we're in February, it's the month of love. Let's talk lips, ladies.
Absolutely.
So I know the trending is definitely much more natural look.
Definitely.
Less is more.
100%.
Big is out, balance is in. So... Oh, thank you.
I love that. Big is out, balance is in. So using that caption.
Hashtag Emma Heaney.
Patent.
So, what tips would you give to a patient when they're seeking an injector for lips?
So, if a patient is looking for a practitioner to do their lip filler or do any aesthetic treatment, for me, finding someone looking at their qualifications, their medical qualifications, I am a big advocate for doctors, dentists, pharmacists, nurses, someone with a medical qualification and experience behind them to make sure that our patients are ultimately getting a beautiful result, but are having it done safely and appropriately. So that's my number one tip for any patient looking for a lip filler. But on top of that, I think you need to find a practitioner that you relate to. Someone that you look at either personally or through their marketing, through their clinic, someone that you feel like, I could trust this person. I love what they do. I love the results that they are producing. I can relate to them and I will feel comfortable having them treat my face or enhance my face. And I think having that rapport and that relationship, finding someone that you can build a rapport with is really important.
I think that's probably the key.
Yeah,
you know,
absolutely.
I mean, we talk patient safety a lot. I mean, and we all advocate for patient safety, but yeah, you have to. I might not be that person's injector, you know, and that's okay. But yeah, I think your rapport with your patient is so important.
Absolutely.
And Lisa, have you anything to add to that?
Yeah, no, I mean, everything that Bonny says, I totally agree with. Looking at the credentials, making sure that they are suitably qualified. Yes, a medical professional, 100%, that they can deal with a complication should a complication arise, because obviously it can happen. But also someone, yes, with the rapport, totally, someone who you're vibing with and they get who you are. But someone who can do an assessment, someone who can understand the anatomy, someone who can look at the perioral region and say, okay, let's look inside the mouth. Have you got teeth missing? Is there support needed? Have you got bony reabsorption? Do you have perioral lines? Do we need to kind of build up the kind of scaffolding before we inject the lips? Sometimes you'll see these patients with these huge lips and they have a lot of deep set wrinkles, or they've got hollowness in the round because they haven't got a denture, or maybe they went with their denture in but actually the practitioner didn't take into account, well, how are they going to look when they take that tooth out? Or, you know, so that someone who really knows how to do an assessment and knows how to treatment plan based on that assessment, because every single patient is individual. Not all lips are the same. Yeah, that's for me probably.
I think, respect the anatomy.
Yeah,
understand your anatomy. And I think you made a really, really valid point there where you said can manage complications. It's okay injecting a lip, but what happens when it goes wrong? I mean, I think that is so important.
Absolutely.
So I think that's part of the consultation process.
Yeah,
you know.
absolutely.
And while the consultation, people think, oh, do I need a consultation? Yes, you do.
Yeah.
You know, I think that is the pinnacle point of our treatment protocol.
Absolutely. I truly believe actually the consultation is one of the most impactful steps. I mean, I'll relay this to my patients. To get the best result, it's not just your ideas and it's not just my ideas. We need to collaborate. I need to find out what you want. What are your desires? How do you want to look? Tell me what you're thinking for yourself, because I can't produce a result without knowing who you are, what you want. So if I go off just my agenda or just your agenda, we're never going to land at the best results. We need to collaborate. I need to hear you out. I need to know you. And you need to know what I can do, and let's make the best plan together. Yeah. Absolutely.
Excellent.
Yeah.
So if a patient's getting their lips done, what tips would you give them before the appointment? After when they've had the consultation, obviously they come back then for their injectable appointment. What tips would you give them before their appointment? I know my first one is no alcohol, but
practical advice.
Yes, practical.
Practical advice. I mean, no alcohol. I like to limit exercise, caffeine 24 hours before. Anything that can maybe cause an extra complication that wouldn't have been there hadn't we done some things before. So anything that can thin the blood, the alcohol, the exercise, the caffeine, avoiding extreme heats. You know, patients sometimes go for a sunbed and they come to have, you know, almost a self-care day. I mean, I don't advocate sunbeds, but this is what they do. But yes, anything that can thin the blood, making bruising, hematoma, swelling much more prevalent or more obvious. They're practical kind of tips that we would give our patients. Something a little bit different though that I often tell my patients, and back to what we just talked about before, is I love my patients coming with an idea of what they want. Some patients will land and just expect you to know what to do, which we do a lot of the time. But it's really important before a patient comes for a treatment that they have a vision of themselves so that we can try and meet their expectations. I think that's important.
It's meet and manage expectations,
100%.
absolutely. And Lisa, do you have anything to add to that?
Probably one of the most basic is no makeup. At the end of the day, you know, you'll see patients coming in, and I am a big advocate for full face makeup, as you can see. But no, in all honesty, dermal filler is an implant. It's going to remain in the body for up to 9 months plus. I don't want any biofilms I don't want any bacteria or anything entering the bloodstream that could harvest an infection, which will be much more difficult to treat once it's embedded itself in that dermal filler. So no makeup whatsoever. It is a steroid procedure. We will cleanse the skin properly before we inject, but just come with no makeup. It makes it so much easier.
Absolutely.
Yeah. I think, our message goes out to our patients to come to your appointment with no makeup anyway.
Yeah.
So sometimes it's adhered to.
So I'm one of those.
Aftercare, Lisa, what would you give your patients advice for? If they've had their lips done, what's the aftercare?
Aftercare, same, no makeup for 24 hours. You are advised to avoid alcohol, no hot drinks. I think that's always one that you forget after the first. I mean, for the first hour, there's some lidocaine, which is numbing, in the product. So a hot drink, you may cause a blister. Again, no vigorous exercise for 24 hours, just because that could entice bruising. But if there is bruising later on, you can apply some cool packs. The day after, you could maybe apply some heat that will enable the bruise just to subside.
Local Women Magazine presents Local Women Podcast, the show for things that matter. The Aesthetic Podcast from Local Women Magazine. This podcast is brought to you by BTL Aesthetics Ireland, supporting clinics with aesthetic solutions.
So, Dr. Bonny, could you elaborate on what the misconceptions of lip filler are?
I think quite often patients think that a lip filler has to look fake, has to look obvious. Quite often we see our friends, our colleagues, our family maybe walking around with an obvious lip filler and we think, gosh, that's what a lip filler looks like. It's not. We don't notice 90% of our friends, family, people walking around with very undetectable results. Lips have been treated with filler, but it's not noticeable. So I think that's a huge misconception. Number one, patients thinking that it should look fake, it should look obvious, it should look noticeable. Actually, most people are walking around with wee tweakments that go unnoticed. When you go to an expert practitioner, that's the results you're going to get. Subtle, unassuming and natural lips, they don't need to look over-exaggerated.
Yeah, I would absolutely agree. I think we call it the elite lip. Not that I've branded it or anything.
Oh,
but less is more in elite. It looks very subtle. It looks like it's your lip.
Absolutely.
So that's what my goal is.
In terms of product choice as well, I think going to a suitable practitioner who understands the rheology behind the lip filler.
Absolutely.
The products that we use, there's a technology in them called expression technology, which the Americans call it, or optimal balance technology. Me, myself, I prefer expression technology because you're placing a product in the lip that you want to integrate within the tissues. You want to be able to kiss someone without them going, oh, it's big, hard, rubbery lips,
Yes.
It's a huge fear. Patients don't come for a lip filler because this is what they think it's going to look like. And I think it's our job to ensure that they understand it doesn't have to be like that. I mean, look at all of us sitting here, probably with lips done. Yes?
Yes.
No, I don't think.
And it's a massive fear that we need to educate our patients that it can be done so beautifully.
Absolutely. And I think it has to be perioral rejuvenation in proportion with the chin. And I think if you've got a beautiful feature like big eyes, you can't have big lips because you don't want to outbalance the face.
Absolutely.
So I explain that all to my patient. If they come in and I think, well, your eyes are wow. So your lips can complement, but they can't overshadow from the eyes. I think that's a really important point.
Yeah, huge, amazing.
So what distinguishes a good lip to a great lip? Oh, is that a nice question?
For me, it's all about that undetectable result.
Yeah, absolutely.
Patients, often when you say this out loud, undetectable, they think, oh, she wants to create a thin lip, she wants to make it look unnoticeable. Yes, that is one side of undetectable, but you can, if patients want a bigger lip look, it can still be undetectable. Undetectable to me means that when you look at someone, it's not obvious that a procedure has been done. It doesn't necessarily have to be thin or small. So that's managing the anatomy of the lip, ensuring that the lip still has a tapering look to it. You're not over volumizing the lateral sides and creating that kind of sausage look to the lip. You can go big, you can go glam and just respect the natural anatomy and it can still look undetectable. I think a great lip just looks like it's not been done, no matter what the size.
Yeah. Is it the best injectable is undetectable?
Absolutely.
Yes. I think we've all
you need
used
a
that
wee
at one
book
point.
with all these.
One-liners.
Oh, yeah, I love them.
I'm here all day. I think that's a beautiful answer. Absolutely.
Definitely.
What about lip flips, ladies? I hear that there's a lot of talk about them. Do people ask for them in your clinic?
They are so popular in
Aren't
my
they?
clinic, but I have had one and I did love it.
Yeah.
But this is the beauty of aesthetic medicine. Everyone reacts differently to different things. they're so popular. I have patients come 10 times a day for them. I tried it for myself and like I couldn't do it.
No,
I just
it wasn't
couldn't.
for me
it
personally.
wasn't for me.
But I do love the result of it, and I've seen a lot of my patients like, can we have the elite flip?
Yeah,
it's
absolutely.
a lip flip. It's a strange sensation, but it's so popular.
So popular, and some people don't get the sensation, so everyone is different. This is the beauty of having the assessment, the consultation, understanding the what ifs, so that people can make an informed choice. But yeah, love the treatment on other people. I want it, tried it, no.
What about you, Lisa?
With the lip flip, I don't think everyone is a suitable candidate.
I agree.
If you have a long philtrum, then you're going to end up like with your lip, because technically what the lip flip is doing, it's working on the muscle. So it's going to relax that muscle. So if you want an everted lip, then go for it. But as long as your practitioner understands and can explain to you that this will elongate the philtrum columns, which will make you look longer and drawn out. So you just need to be sure that you're the right candidate for lip flip, and you're just not going willy-nilly to anybody and they're saying, oh, let's stick a bit of neurotoxin in the lip and see what effect we get, because it can make you look a little bit strange. Yes, Emma, that look there. Do that. On your smiling, it's kind of like...
Not to down the old lip flip, it is good.
in the right hands,
Don't
and
get a
in the
lip flip, no,
in the right hands, and in the right patient, and in the right practitioner. Right, the 3 Ps: your product, your patient. You know, I totally agree that it is a great procedure. It won't last very long around the mouth. It's a hypermobile area, so the muscle is going to work that out in about 6 weeks. So it can be an expensive treatment for short-lived time, but if you get it right, I completely agree, Bonny, it can look gorgeous.
Yes.
I've never personally had one, so maybe I shouldn't be commenting.
For anyone that doesn't know, the difference in a lip flip is, you know, it's a neurotoxin. It uncurls the lips. So quite often we do it for patients who...
It inverts it, yeah.
Yeah, absolutely. So if patients are their lips are curling when they smile, do a lip flip.
Yes.
If they want volume, hydration, definition, do a lip filler. So that's the main difference, really, isn't it?
Yeah, for sure.
And as Lisa said, it is short-lived. And I think when I do it for my patients, that's the first thing I say to them in the consultation is, you know, this isn't going to last as long as other neurotoxins that you know, where you're going to put them in other areas. But it is a beautiful, on some of the patients, it's absolutely beautiful. But you're right patient, right product, right place.
For sure.
Absolutely.
Yeah, no, as you say, and it can be really natural. And it is someone, if they don't want to kind of go into the dermal filler route right away, then it's a nice entry.
It is.
To it.
Or I find sometimes as well, if they're not quite ready for another lip filler or it's not time, it can prolong.
Yes.
Do you find that?
Yeah, it can give them a result that they're looking without the downsides of adding filler when it's not needed, it's not necessary, it's not appropriate. You can opt for a result from a lip flip instead of adding more filler.
Yeah, I would agree.
Yeah.
Just be sure that you don't like play any musical instruments.
Or try and drink out of a
You're
straw.
a whistler. Yes, a professional whistler. You may have difficulty with following your lip flip.
How did that go again, Lisa?
I can't whistle. I had a lip flip.
So when we're talking about neurotoxins and the lower face, I mean, that is so popular. There's loads of people on TikTok, which really, really annoys me, placing it in the wrong area. Lower face toxin is a very advanced procedure. It's not everybody that can do it or can do it well. Your thoughts on lower face toxin?
Oh yeah, in the wrong hands, like it can be deadly. Not deadly, well it can, yeah.
Yeah, well, toxin can
it could be. Yeah, I mean, if you inject too much in around the neck area, but I suppose that's for another
we could do that on another time.
Yes.
Yeah.
But no, it is great. It's great because neck treatments are all in. And I think definitely, you know, combining treatments and treating the neck area. I know you said you do polynucleotides and Profilo. That combined with toxin, because obviously we need to work on the muscle. So neck toxin is great. Actually, I'm a big fan of that myself. I love that.
And your neck looks beautiful.
Oh, thank you.
So before we wrap up, what's happening in face therapy and eye at the moment?
Oh my goodness. So we've just built an extension with 2 surgical theatres. We are massively jumping on the trend of regenerative aesthetics, offering, we've got some brand new devices in clinic as well. We're offering face tight, neck tight. These are kind of like minimally invasive procedures that when you're not ready to go into the surgical route right away, have a plastic surgeon who comes over and offers those procedures. So yeah, all down the natural kind of regenerative route. We're all about that.
Lovely. And Dr. Bonny, what's happening in your clinic?
Do you know what? we're having a different kind of year. We feel really happy where we are at the moment. We're a team of 10 females in our clinic, and we've got an ethos this year about just perfecting what we're already doing, adding a bit of luxury, adding a bit of oomph, adding those extras to our patients already. And actually, as a team of women, we're just hoping to have a good time this year.
Can I come?
Yeah.
Can I come too?
Absolutely. We're all about the good vibes this year, good memories, happiness, laughs. And yeah, that's what we're really concentrating on this year, just loving what we're doing.
So that's a wrap really for today's podcast, but I want to take this opportunity to thank these two amazing ladies, and which I probably forgot to say, multi-award winning ladies, and I have the pleasure to call them my friends. So thank you for listening to our podcast today, and thank you, ladies.
Thank you.
Thank you.
It was awesome.
Local Women Magazine presents Local Women Podcast, the show for things that matter. The Aesthetic Podcast from Local Women Magazine. This podcast is brought to you by BTL Aesthetics Ireland, supporting clinics with aesthetic solutions.